Fertility for women with cancer. Sometimes women find out they have cancer while they still hope to have children in the future. If this happens to you, it is important to know how your cancer or cancer treatment might affect your fertility or ability to have a baby. Based on your wishes and health needs, there may be options available to increase your chance of having children after your cancer treatment has ended. Not all cancer treatments affect fertility. Ask your doctor if the treatments planned for your care can change your ability to have children. Your doctor can explain these changes and if they are temporary, long-lasting, or permanent. If you desire to have children, it is important that you talk to your doctor or another member of your healthcare team before your cancer treatment begins. A cancer diagnosis can cause emotions and feelings that you may never have had before. Thoughts of your sexuality or fertility may not seem important at this time. However, by talking about this topic before starting cancer treatment, your doctor can offer more options to protect your fertility than if you share this information after treatment starts. Talk to your healthcare team about any physical or emotional changes you may have so they can offer support and, if needed, refer you to a specialist for problems such as anxiety, depression, hormone imbalance, sexual dysfunction, or other sexual concerns. It is common to have many different feelings such as sadness or anger if you have fertility problems. Reach out and share your feelings with those you trust. Spiritual or professional counseling may help you understand the reasons for your feelings and how to manage them. Your doctor can help determine if you have fertility problems. They will check to see if you are able to produce an egg to be fertilized, which is needed in order to become pregnant. They will also see if your body appears to be able to carry a baby to full term. Physical changes from cancer or cancer treatment that can cause fertility problems in women include certain types of chemotherapy, immune therapy, or radiation therapy that can cause damage to your eggs or your ovaries. Ovaries are the organ in your body which make female hormones and also hold eggs. Female hormones help you to have a healthy heart, brain, and bones. These hormones also help your sexual and reproductive organs work correctly. Your hormones must work properly so you can produce the eggs to be fertilized in order to become pregnant. Based on the type and location of radiation treatments, there may be damage to other reproductive organs, such as your uterus or vagina. This can make it difficult to have sex or successfully carry a baby. Surgery may include the removal of reproductive organs needed for having a baby. Radiation to your whole body or radiation to just your head can cause damage to the pituitary gland. The pituitary gland is located near the base of the brain and produces hormones needed for pregnancy. Bone marrow or stem cell transplant often lead to a loss of fertility due to the chemotherapy and radiation required during treatment. Hormone therapy is sometimes used for certain types of cancer, such as breast cancer. The effect of this treatment may lower your ability to become pregnant while you are taking this medicine. In addition to certain types of cancer, such as cancer of the ovaries, cervix, endometrium, or uterus, and some cancer treatments that can cause fertility problems, there are other factors that may lower a female cancer survivor's fertility. Some of these factors include age. Fertility decreases as you grow older. Health problems, other than cancer, may affect your fertility. Other problems with your reproductive organs that you were not aware of before you found out you had cancer. If your cancer or cancer treatment puts your fertility at risk, your doctor may suggest you meet with a healthcare provider who specializes in this area. This may include a reproductive endocrinologist, fertility specialist, or OB/GYN doctor. These medical specialists work with you to provide treatments which can improve your ability to have a baby in the future. They may suggest you take action before your cancer treatment begins, or recommend safety measures during treatment. After the end of your cancer treatment, they can also talk with you about available fertility options. It is important to know the risks involved and the chance of success for each fertility option your doctor may suggest. In some cases, more than one fertility option may be available. If a woman has a partner, he or she should be included in fertility discussions and the decision-making process. Fertility issues may affect your partner and your relationship. Your doctor can explain the options to help protect or keep your fertility. These options will be based on your cancer, its location, cancer treatments, those planned or received, and any other health problems you may have. Share with your doctor any cultural, religious, or personal beliefs you have about medically assisted fertilization, so the right fertility options can be chosen. If your cancer treatment has not started, it is important to understand that some options to protect female fertility take time to complete. Based on when your cancer treatment is to start, your doctor can review which options are best for you. Your doctor will also explain if any of these options would delay the start of your cancer treatment and how that delay might impact your cancer care. Here are some of the fertility options used to help protect or keep fertility. If chemotherapy is planned, your doctor may be able to choose a type or dose of chemotherapy that has a limited effect on your fertility. If radiation is planned, shielding your pelvic area to protect your reproductive organs may be needed. A special type of protective surgery may be used called ovarian transposition. This surgery involves moving your ovaries to a new spot in your body before cancer treatment and returning them to their regular location after cancer treatment has ended. Based on your cancer, you may be able to use medicine instead of surgery or have surgery that does not remove all the female reproductive organs. Embryo banking may be possible. During this surgery, a few eggs are removed from a woman and fertilized in a laboratory dish. These fertilized eggs are then stored until they are ready for use. Egg banking may also be an option. This is the surgical removal and storage of unfertilized eggs taken from the ovaries. Ovarian tissue cryopreservation is a new treatment being studied to help protect fertility. This treatment involves removing all or part of one ovary and freezing the ovary for later use. The science of fertility for cancer survivors continues to grow. New promising research and treatments are being studied so larger groups of cancer patients have the ability to bear children following cancer treatment. There are times during or after cancer treatment when you might need to take precautions and use birth control to prevent pregnancy. For example, it is very important to not have unprotected sex while you are being treated with chemotherapy. Your doctor will let you know which birth control methods are safe, as well as when and how long you need to use them. Insurance companies may or may not cover the cost of fertility testing, treatments, and other related charges. It is important to check with your insurance company about which fertility treatments are covered. You may also want to check with your employer or insurance company to see if there are other health plans available to you that include fertility coverage. Ask your doctor about any organizations or resources that may be available to help you with the cost of these treatments. Based on this coverage and your finances, decisions for treatment can be made with your healthcare team. If fertility treatments do not work or are not possible, Adoption of a child through various agencies or private adoption may be an option for you. You may also decide to have another woman carry a pregnancy for you. This is called gestational surrogacy. You may want to talk to a lawyer about adoption or surrogacy options. They can help explain any legal issues that you should be aware of with these choices. Some people, along with their partners, decide to not have children after a cancer diagnosis. Due to fertility problems or based on their goals for the future, they choose to focus on other areas of their life other than having a baby. These are very personal decisions that should be talked about openly and honestly by couples in order to reach a decision that is comfortable for both. We hope this information has helped you to better understand the impact cancer and cancer treatment can have on your fertility. Options to protect your ability to have a child in the future should be discussed with your doctor as soon as possible after a cancer diagnosis. Write down any questions you might have for your healthcare team and bring them with you to each appointment. We are honored to care for you during your cancer treatment. Thank you for choosing the James.